arrest. So thank you that you have arrived. And I would like to open the first morning session, which is always the most difficult one, but I see that we are very many, so thank you very much, and people are still coming. So just to say that Gladys is taking fantastic care of all of us. Thank you, Gladys. And for organizing everything, and she also keeps in mind our brain plasticity. So I have received slightly different materials from her, but as an old school member, I will just stick to the printed one because it, and we may start now with our first speaker. It is my honor to welcome Ellie Jerman from Alzheimer Society, United Kingdom, who will present project on Punjabi community, which is one of the finalists for the anti-stigma award of Alzheimer Society. That is a new activity of Alzheimer Europe that we have just opened, and we were very, very surprised. We just guessed how many organizations and activities might apply for this award, and we were very, very surprised, and it was very nice surprise that it was over 50. So congratulations also for being finalist, because this is already incredible success. So the floor is yours. May I invite you, Ellie, to give us the presentation. May I ask you first to close the door, please, so that may I ask you to close the door, please? Because I hope that everybody already arrived.
There we are, the right one. Thank you so much for inviting me here to talk today. It's such an honor, and we're just thrilled to be shortlisted for this award. And I want to start by introducing you to a lady called Bhagwant, once the slide changes. Sorry. There we are, right one. This is Bhagwant. She is 83 and she lives alone in Wolverhampton in the UK. But she loves to go twice a week to her local ladies group where she can sing and dance and eat and share stories with other members of the Punjabi community. And it's the friends in this group that notice Bhagwant's change in behaviour. She would struggle to remember their names or become easily confused. And they told her that she was going mad or losing her mind, which they never meant in an offensive way. They just didn't have the knowledge or understanding that what she was experiencing could be a sign of dementia. And we know that Bhagwant's story isn't unique. Our research shows that the South Asian community face really culturally specific barriers to dementia diagnosis. This includes difficulties with language and communication between themselves and healthcare professionals, low awareness of dementia being a diagnosable medical condition, as well as the cultural perceptions around caregiving as being something that should be taken care of within the family rather than seeking external help, as well as cultural perceptions of dementia itself being a sign of going mad or losing your mind, as Bhagwant experienced. And all of these different things combined generate such a strong sense of stigma that many in the community are forced to live in silence or simply don't understand what's happening to them, so can't access the vital support and care that they need. So as part of our Dementia Action Week campaign for 2022, which focused on the theme of diagnosis and based on the prevalence of dementia in South Asian communities, we developed a new information hub for our website with culturally bespoke resources for the Punjabi community. And we chose Punjabi as the starting point for this pilot project because it's the second most commonly spoken non-English language in the UK. And the idea will be to roll out this template across other projects and cultures in the future. But to ensure that these resources best met the needs of this community, we really needed to understand it from their point of view. So we worked with our expert project consultant, Dr. Karen Jutler, as well as an internal group and network of volunteers from Alzheimer Society from the community. We also had an expert advisory group full of people living with and affected by dementia from outside of our organisation. And we also had a Punjabi-speaking film director. And all of this meant that what we created was directly informed by first-hand experience, addressing stigma by educating and raising awareness in a really culturally bespoke way. So you can see on all the various screens here some of the ways in which we did this, and front and centre were two incredibly culturally bespoke and powerful videos. The first was an information film, which explained what dementia is, the signs and the symptoms, to break down the stigma of dementia and really tackle that this is a medical condition. The second was Bhagwant's story, and she really bravely opened up about the adversity she first faced when she started experiencing her symptoms, but through seeking a diagnosis has been able to share her experience with her friends and change their perception of what dementia is. And I was there on the day that we filmed Bhagwant's story, and it was incredibly powerful and moving. We also translated two of our core publications called 5 Things You Should Know About Dementia and Worried About Your Memory to make it more accessible to the community, and over 1,000 copies of these were already in circulation. And on the right-hand side of the screen there, you can see our translated Main Dementia Action Week campaign posters, which focus on the idea that repeated questioning is not a sign of normal aging, and that it can actually be a sign of dementia. And through doing all of this research and insight, we were able to create resources that were incredibly culturally bespoke and that had impact to the community. And this has been felt through the number of web views that we've had. So the videos have been viewed over 2,500 times. And the average time spent on this web page is 127% higher than across the rest of our website, which shows that the engagement is incredibly meaningful. The impact has also been felt through media coverage, through online and print and broadcast media. And we had an exclusive article in the Guardian newspaper, which is a really high-profile newspaper in the UK. And also front-page coverage in Asian Leader, which is a really popular regional newspaper, helping us really get to the community. And really heartwarmingly, we felt the impact through the reactions that we've had. And you can see some of the comments on screen there about how helpful these resources have been about educating, raising awareness, and breaking down the stigma and taboo this community faces. And now that we've developed all these resources, we've begun really targeted outreach work to get them into communities through local support groups and religious centres and through healthcare professionals to help develop their understanding of the community's needs. Because we want others like Bhagwant to live well with dementia. You saw her fleetingly there. We know what she looks like now. We want others like Bhagwant to live well with dementia without the fear and the stigma that so often consumes members of this community who are living with dementia. And we want them to access the vital healthcare and support that they need. Thank you.
Thank you very much, Ellie, for your presentation, and congratulations to the work that you have done already, and fingers crossed for the finale. So we will see today afternoon. And I think we have time for a quick question. So if somebody wants to ask something now, it is also possible because you kept on time perfectly. And I do not see anybody here, and nobody online. I see somebody. Yes, please.
Oh, hi. Excellent, innovative project you've done. Is the video in English or is it in Punjabi?
Sorry, I should have stayed up there. So through what we learned through our expert advisory group and through working with Dr. Karen Jutler, we learned that the best way to reach the community across all ages was to be English speaking, as that's most accessible for the older members of the community, but also to be have Punjabi subtitles on it, so it's dual language. And with Bhagwant, her natural dialect is mixed English-Punjabi, so we really lent into that in the filmmaking. And it was such an incredible thing to witness, because I don't speak Punjabi myself, but to witness the engagement between Dr. Karen and our film director and Bhagwant was just incredible. So yeah, it was dual language, we mixed it up.
Thank you for this explanation. Another question here, please. Nobody nobody online as well. There was a complaint about sound, but I think it was something that Gladys already sorted out. So thank you, Gladys, again. And may I introduce our next speaker? It is the host of our conference, chair of our Romanian Alzheimer Society, professor of psychiatry, my dear friend since a very long time, Catalina Tudose, who will speak about progress of dementia care system in Romania as a consequence of European integration and support. The floor is yours, Catalina.
Thank you. I don't think I managed this. I think it's okay. How can I move the slides?
I think the green one.
Yeah, thank you. Good morning, everybody. So that, as I have spoken in the first day, thinking how things have progressed in Romania due to our integration and collaboration, and due to the bridges built with European collaborators, I will briefly summarize some aspects. It's a long history, so we have been set up in 1992, and as I have told you, it was a moment when a lot of things happened in our country, in all Europe, and this was an essential aspect for us. So we have been immediately included, I mean, we go step by step, but we become full members of Alzheimer Europe. So very soon, we in Poland, I think we were one of the first countries from Eastern Europe, and in 1995 of ADI, because we fulfill the criteria. We were very enthusiastic and ambitious that time, and we try to do it. So for the first moment, we learn how to do things, because NGOs were not, they were also something new in a society as Romania, so it was not possible people to come together, more than 5 people, I don't know if you know. I hope these times will not come again, so that everything was new. So that the main goal, this is important, the main goal for us at the beginning, because the needs were so big and so, you know, various, so we have the tendency to do practical things, because we try to know how to do it from international associations, but to give education and the leaflets and things like that when the people have big problems. So we have we intended that we did it very concrete projects. Something also typical, I think it's important to know from, and I think it's common for previous communist countries, is that the professionists were those who set up these associations, this organization, in order to do something for this population, and not the beneficiaries, not the family members, because they were not aware. I mean, we were merely aware about our rights. So the early projects were to identify the needs of the people, and the needs were of social kind, not on medical one. So there were programs as Meals on Wheels. It was something new for Romania, helpline for these people. And step by step we developed also in jumelage with other foreign organizations. HelpAge International was one of our sustained partner, bigger projects, also concentrated on concrete help. I don't want to mention all the projects, but I want to, because I don't want to bother you, but we set up Alzheimer centers in Bucharest, in Timișoara, and also in a rural area, in Nehoiu. There were money from jumelage projects from European Council that time. We developed an educational program that for carers and caregivers, and we succeed to include in the nomenclature of the professions of a new profession, that it was home care for old persons suffering of psychiatric and behavioral problems in 1996. So then we developed a home care program using there were more than 60 carers. So we have 90 families in care at that time, 2 or 3 years. And in 1996 we succeeded to have no, it's a mistake. In 2005 we succeeded to perform a marketing research all over the country. It's important that in 1996 we tried to find how many people were diagnosed in Bucharest in all the outpatients clinic, and we found 24 persons. So there were times when Alzheimer was not known at all. Even my generation learned that it's something very, very rare, that it happens maybe in one's doctor life you find 1 or 2 cases. So this was the situation that time. These are what I have already said. The first, it was a community day center generally for elderly, and then they became more specific for people with Alzheimer. There are some photos from that time. As I have told you, there were almost nothing specific for this category of people. But people from Alzheimer Europe and from ADI, they came and visit us and they say, look, it's not good. I mean, you have not to do something instead of the government, instead of the, it has to be a national policy. You as an NGO, you cannot do too much with this pilot, very nice, but pilot projects, so that we listen to the advice, because the projects, as Professor Alexander Kut said, the projects finished, the money finished, anything was happened. The local authority, even if it was a very successful project, 20 people, 30 people, 50 people, are not convincing the authorities at that time that it is something important to be continued, and anyway, it was expensive for the resources. But we didn't think too much at the beginning, you know, this was a tendency to offer something. So that we change our strategy. Of course, we noticed that the people are coming in the last stages of the disease, so that we have to do something for earlier diagnosis anyway, at least at the medium level. That's why we developed other projects as a memory center, and we developed big educational programs for professionists first, but also for carers. This was possible because we were included in European projects. There were, through Alzheimer Europe, first epidemiological evaluation. In 2007, there are already about 15,000 people diagnosed in Bucharest. So the things, due to it was not only Alzheimer Society, of course, but I think that we were the enzyme, let's say. There are a lot of, and professionists were interested, and young specialists were interested, so that things here, and I think, unfortunately, it's still the situation, where we didn't succeed in 30 years of activity to develop a national policy, but everything was spread like in an oil stain, and this can be felt if we can be accustomed, happy with this. Also, we were involved in a lot of other groups, also in the same style, let's say, also clinical trials, or I and my colleagues were involved in the development of curricula of all-day psychiatry, and we succeed to introduce this new specialty in Romania, you know, things like that. So the Memory Center is one of the most important projects that is still continuing. It's very successful, but again, not multiplied at the national level. I mentioned you this research. Anyway, the idea is that we passed from concrete, transversal, let's say, interventions to more perspective strategies in a comprehensive intervention of dementia, and Memory Center was one of the most aspects, because this Memory Center also after models, so we learn all the time, and we learn from, we visited EVA, I don't know, 10, 15 years ago. So we learn from people who are doing different other things linked with community. And this has a special structure. I mean, a multidisciplinary team. It's an interface between medical and societal as long as we can. Support groups have been developed, and a lot of volunteering, a lot of times. So education was the second direction. Also, we were sustained and influenced about many people who, about European colleagues. You can see here pictures from different, I was one of the most active from the group, but not only me. And with international recognition, and also this was also the 11th Alzheimer Europe Conference in Bucharest was very successful, and we are very glad that we have been chosen to do this. Then in the second, as I think in integration of Romania in European community means a lot of things for us, because we were present in all the Brussels meetings, all the things that are happening at the European level, we were invited. We have created, after the model of European Parliament, a Romanian Alzheimer Alliance, more or less successful, but from that time we begin to organize annual national conferences. We do it before, but it's a smaller, let's say, range. Now we organize big conferences. Usually we have 600, 700, 800 people after this model, inviting beneficiaries, carers, politicians, lawyers, also medical staff. And this, I think, it's one of the main projects that have developed, have included a lot of people in the country to be interested and to develop at their turn a lot of projects. And we have gradually, in 2012, 2013, make a lot of steps to develop a national dementia strategy. We elaborated a project. We used to have other these are conferences you can see from different places. This national project and plan include a lot of activities with try to establish some deadline. That was continued with this POCA project, mental health, a priority on the public agenda, stressing on elderly people. These materials are on the agenda of the government, but waiting, so it's the same problem. But there is a lot of pressure. There are a lot of European Parliament, Romanian parliamentarians who knows about, a lot of people from the parliament, so that we hope that things will change. These are among the last projects that we developed. I didn't write them all, but what is important, this kind of projects that happens in the last years are, as you all know, because you are involved in, bigger projects that try to put European countries together to find standardized way to approach and different aspects of dementia. For instance, it was also before the INDEC, and also indeed, for instance, in this project, it was a very deep analysis, of all the ethnographical condition, cultural condition in the Nubian countries. Please help me, as always. Thank you. And I never find in a book something like this. Really, I think there were 2 or 3 years when we meet and we analyze the different conditions in different Danubian countries, quite different countries, as we can see now. So trying to find a common rules of good sense, something that's to be applicable to all countries and to unify. So this, as conclusion, of course it was not only Alzheimer Society, as I have told you, but we are not, developed a national policy, but we are a strong brand, I can tell you, in Romania, because shortly we have introduced a professor for, now there are people who can be employed with this, and we hope to be also to influence their education, a new specialty, new services, research how we could in different kind of research, and we'll hope in a national dementia plan. And also your presence here, it's another success for us, and thank you, the organizer, for telling us, for trusting us to do this. Thank you for your attention.
Thank you very much, Catalina, for your great presentation. That was even moving for me because I could sign it, this experience, maybe with different numbers and events, but with so many similarities on behalf of the Czech Republic. And I think that the very similar situation was in Slovakia, was in Poland, and so on. And the common situation in Central and Eastern European countries, and it shows us the importance, and you have clearly shown it, the importance of being again in Europe, yeah. That we were split from for many as 30 years through different impact of Russian and Soviet either influence or occupation directly in our country, and presence of their military and so on. So it is the impact that is still visible, and we have been showing this also in the European Dementia Monitor, because when you go to different shops in different parts of Europe, the goods is very similar there, everywhere. But when you look at the care of the most vulnerable people, there are still differences, and you can still see the impact of Iron Curtain, and therefore we feel that it is so important to help to change this current situation, help our colleagues from Ukraine, because it could have also impact for many other decades. But yeah, we have to stay optimistic and collaborate, and I think that this mutual support and collaboration is the most important. Sorry for taking such a long time for my question that I wanted to introduce. What was the most difficult for your organization and for you personally during this development, Catalina?
To continue projects, I mean, this was very sad to develop something and then to see that almost nothing is, not almost nothing, I mean, it's something, I mean, you see you have not the satisfaction that things are continuing. In fact, there are influences, but for instance, for the 60 carers, professional carers that we trained, it's true that they were not paid by the system, so the families have no money. I think the majority are in Israel, Italy, Spain. I mean, we prepare people to do for elderly people something, but things like that. And also services that the local authority, I mean, Nori Graham and Hankton Haar, they were right. They said you are too ambitious. The society is not prepared for what you want to translate from abroad here. And they were right, but it lasted 30 years. It's
and therefore we are a bit more tired than anybody could expect. Thank you very much, and there is still... And I hope that we will have also time for discussions in the end of this session. So let me please introduce our next speaker, who is Irina Shevchenko from Ukraine, and she will give her presentation and inform us about dementia at times of war, the way of supporting people with dementia, carers, and researchers from Ukraine.
Thank you.
Welcome, Irina. The floor is yours.
Thank you very much. Good morning, everybody. Thank you for having me here today. I'm the first time in Alzheimer Europe. I'm very excited to be here, to listen to every presentation that I heard during these days. And this presentation of Catalina, actually, this is so inspiring for me because you told about your experience of all these years, and I understand that we are in the beginning. And what a big road we have to do, but this is so inspiring to understand that this is possible in all your countries, so we will also do it one day. So it's very good. So today, I will speak about a little bit about Ukraine, about our association, and about the last 7 months that we are facing. But as well, I will very briefly present our research that we have just finished, that will tell about the needs of people during the times of war. Let me start with Ukraine. So in Ukraine, according to the Lancet Institute, there are 651,000 people with dementia. In the Institute of Gerontology in Ukraine, I was told that there are numbers of around 800,000 to 1 million people with dementia before the war. According to the official data, there are 62,000 people with dementia. So we understand that in dementia we are way under-diagnosed about dementia. People, unfortunately, do not know what is it. The awareness is very, very low. And when my granny faced dementia, I realized that actually there are no support programs for the families like ours. There are no governmental programs, financial support, nothing. So I made a decision that we should change the things. So in the beginning of last year, I finally founded the association. So we are very young. The whole last year was a year of establishing of the organization, of all the different pilot projects that we launched. We were lucky because of all of you, because we analyzed the experience of the West, of the neighboring countries, and we launched the memory cafes, the support groups. There was actually a lot of attention of the press because we were, finally somebody appeared who started to talk about it. We collaborated with the theater who played the father, and also printed some materials. So we were building the organization like, I would say, I think like a classic association that would build gradually the awareness and the programs. So so these are just some pictures from what we did. We also, we started to develop the application together with IT company. We had a photo project with our people with dementia, with the theater. So also we started the social media, and also there was the first engagement with international partners, which is Alzheimer Switzerland and also ADI. That was last year. So when I was looking at 2021, that was a year of very, very big plans. We were planning to really to maximize our activities, and we had a very, big, ambitious plan. Then after the 24th of February, we stopped everything. We stopped everything that you have just seen on the slides. We never stopped a single day of what we were doing, but we started to do completely different things. Something that we never planned to do, and when we didn't expect to. So basically, we started to do the humanitarian aid as an emergency response to the urgent needs that arose after the war. So the first thing we did was to completely go online because everything was blocked. People were blocked. So we had our psychiatrists started to provide consultations online. Our psychologist therapist continued the groups, but also added online individual consultations with those who needed that. We provided online care support for people with dementia, their relatives. So that was one of the support. What was very unusual for us, that the biggest need was that some people wanted to leave the country and the others wanted to stay. And they had different challenges, and we tried to help all of them. Again, that was not planned. So the country at one moment really gathered as one big volunteering team. And we had at that time, around 70 volunteers at the start of war across Ukraine. We had, before we had Viber groups and Facebook groups with the relatives of people with dementia. So it was at the beginning kind of, everybody started to write, we need this. And then volunteers, we can help. And somebody need this, and somebody could help. So it was more, like a teamwork, not structured, but everybody was trying to help everybody. So one of the biggest needs from the beginning, which was unexpected, was a need of medication. We all were warned millions of times by the West that the war can start. Still in Ukraine, really, we could not believe till the end that it would really happen. We thought, okay, maybe it will start somewhere in the east of the country as 8 years ago. But nobody believed it could be like this, that, on the 24th they will be next to Kyiv, So people did not prepare. So they did not prepare the medications, all the food that was needed. So the biggest questions were, so the pharmacies were closed, people were stuck at home, and the questions were about medications. Can you please help to bring us medications? And we are speaking about elderly people in general, so they needed not only medications for dementia, but the whole set. So our volunteers started to find all over Ukraine pharmacies which were open, and somehow by bicycles somewhere, sometimes, different cases, tried to deliver the medication. Then I moved to Geneva with my daughter when the war started, and I was already in touch with ADI, and I'm super grateful to this organization that they helped me to find this partner, which is the Americas. This is an American organization that helped to provide us a lot of medications to Ukraine. So we brought a ton of medications and still ship it to Ukraine. And now, and we tried to make it structural, and through the Ministry of Social Affairs, social policy, we are distributing now the medications to the gerontology nursing homes and to psychoneurological internats. So now it's more structured, and we continue this program. So that was never something that we were planning about medication. So we were thinking about the quality of life and the social care support. But now, still within 8 months of war, we still see that this is #1 need. People in Ukraine now are, so the poverty is 10 times more than before. So this is a big also financial support for our people. So we want to continue this program for next year. We don't know how long the war will last. Another need, which was very surprising, and that was from the ministry actually that came to us, was the need for generators, because from the beginning of the war, the target was the critical infrastructure, and a lot of institutions were cut out of electricity. Now it's even much worse. 1/3 of the electric plants and facilities were cut out of electricity and last Monday. So we continue bringing the generators. So as an organization, we in the humanitarian field, we focus on medication and generators. There are a lot of organizations now in Ukraine, and they help with hygiene products, with food, with everything. So we were also approached many times to support to children, to support other categories of beneficiaries. But we try, and this is very difficult actually in times of war, to keep with our target audience. They, I believe, are one of the most vulnerable category of all. According to the statistics, there was an analysis. People help children now on the first place, then they help animals, then the first place is military for sure. This is without no doubt. Military, then children, animals, and then elderly people. So we want to keep supporting people with dementia. Then we launched the website together with the organization. Oh, and sorry, I wanted to say that we also, together with a partner, Médecins Sans Frontières, we started to do evacuation. I cannot go back. So there was a lot of response about evacuation. People wanted to go abroad or to go from one side to another side of the city. So our volunteers did it also, each case separately, but then we found a big partner, MSF, with whom we started to do it more in an organized way. Evacuation is one of the biggest needs in such cases. So we then launched a website, which is Nezabudni United. You can access this website. People could access that website. That was additional one to our main one, where people could quickly receive any kind of help, medication, and the rest evacuation support and the rest. And another thing, what was unusual, is that when the war started, we became much, much closer with the government. Before that, we were sending the emails, then waiting 30 days until we got the response. This is now no longer exist in Ukraine. Now we are really like one team. We have mobile phones of top people. They know our mobile phones, so we are now working as a one team. This is really a very big step forward, unfortunately, with these events. But we want to use this opportunity and now to work on the National Dementia Plan with both ministries, Ministry of Health and Ministry of Social Policy. So as for support in Europe, so as I was and I'm in Europe all this time, and I saw people coming as well in Switzerland, and I want to say a separate big thank you to Alzheimer Switzerland and Alzheimer Geneva that helped me a lot when I moved to Geneva. We started to think how we can help people, so we created the leaflet that contains basic information about contacts of the local Alzheimer Society, about our organization, about contacts where people can get support. And ideally, this is a format that I'm thinking that every country should pass this kind of very simple information to the office, to the refugee center where people come when they come to the country. And if there is somebody with dementia, they just give away this leaflet. So this is just an option. If I know there are less people coming, but still, if you could create some kind of very simple contact details of yours and just send it to the local refugee center, that would be I think that would be very useful. And also, if anybody from Ukraine comes to you and you have any request, please contact us. We will also help to help these people. I know that I have no time left. So I wanted to to say that we have just finished the research, which was done by our organization ourselves. I was so impressed by the researches I saw these days. So this is a simple research, but I don't have much time for that. I just wanted to say that that is an interview, 30 interviews with our people with dementia during the times of war. And you can download this research. So there are some outcomes that you can download. So we basically analyze the needs of people. We analyzed the needs of people with dementia, the troubles they were facing. We analyzed what influenced the most their condition, and what are the ways how to minimize that. So really, this is in English language already. This is in a very simple and practical language by how we saw it. And yeah, so we just didn't find anything. We tried to find any information that could be useful for us in the beginning of the war, but we did not. So I hope this can be a first start. And if anybody would like to cooperate on research, we would be very happy to also to develop this direction. Thank you. And I want to thank you all for support to Ukraine for all these months. Please continue supporting Ukraine. The war is going, and I hope that united we can win. Thank you. Thank you.
Thank you very much, Irina. Thank you for your presentation, for your work that you have been doing, and our hearts are with you, and we hope that everything will end soon. And we know that there are many people with dementia staying in your country. Thank you.
No question. Oh, no time for questions.
Well, we will have some time in the end of our session, so now it's time for another speaker. Thank you. And next speaker is Adriana Sęczyszyn from Wrocław, from Poland, who will speak about care between the frozen dementia care in Ukraine and building bridges in Europe, about their experience from Poland.
Yes. So I'm very grateful to be here today, and I want to start my presentation with the same opinion I have, the same statement, that we are still at the beginning of the road. After listening about some extremely interesting researchers and some projects, I came up with the same idea that a lot has been done recently, but we still have so many things to do. And I would like to talk about the experiences of the people I work with Joanna Rymaszewska and Dorota Szcześniak, and some other people who are in two, for us, extremely important projects, Cognizance and Shared. And then I will refer to this period of time when the refugees were coming and how it changed the projects and everything we're doing. So, yes. So, as I said, now we have this great opportunity to cooperate with people all around the world, and we have this possibility of rapid development in a short time. And over the past 5 years, we have participated in 2 significant international projects. One of them was Shared, and it was aimed to answer the question about the role of social health in the onset, course, and progression of dementia. And also we wanted to develop an empirically tested integrational model of the pathways between social health, cognitive reserve, and dementia. In the Cognizance, which was co-created with people with dementia, their relatives, and health and social care workers, first of all, we wanted to have this toolkit that could be available for people of all countries, but also we had this first Polish social campaign aimed to improve the diagnostic process and also the post-diagnostic support. And we created the implementation manual as well. This is the website we have now with articles for people with dementia, also for their carers and some medical and social professionals. We had this art exhibition. We had some mobile diagnostic buses around the city. And also, we had this symphonic concert I will talk briefly about by the end. But here I can say that, at least in Poland, we still have this huge problem that even if we have great social campaigns, they are available only in the cities. So we have this huge difference between people living with dementia and people living with dementia who are living in the city. They have better transportation, they have more centers, of course, they have better medical care. So this is the issue that is still something we have to resolve somehow. Both projects were aimed at fulfilling the Maslow's higher order needs of people living with dementia. The need of belonging, the need of recognition and respect, and also the need of self-actualization in terms of living good life and participating in the cultural life in their community. And suddenly, on February 24, everything changed for us because we had so many people coming to our country. And to be honest, this concept of improving the quality of service, improving them, seemed irrelevant for us when people who were coming to Poland, including those living with dementia, did not have their basic needs met, such as need for safety, for medication, as Irina said, for food, and they had no roof over their head. We had no camps, like we had no places where we can just like find for them. So everything, as I called it, was, yes, and the war completely changed the pyramid. We were just trying to take care about this first physiological needs. And everything was organized in this grassroots way. So we were just calling friends, like trying to find people who have bigger flat and they can just like put somebody there. We were searching for people who spoke Ukraine, and everything was just crazy for us. So all the psychologists and psychiatrists were trying to help people who were coming. So our people living with dementia had, like I would put it in this way, just had to wait for a few months for us to be available for them again. Everything was online. Like we had this great website where 500,000 people were just helping each other, trying to like organize rights, housing, bedding, and everything. And of course, Polish non-profit organizations were extremely helpful here as well. Refugees living with dementia ended up in a general psychiatric care. So some of them came to our hospitals. We were very lucky, at least in my hospital, that we had some people who spoke the language, so it was easier, it's much easier to help them. And here, as I said again, we had this grassroots help, so all the psychiatrists and psychologists, they were just giving their services for free because the country wasn't prepared for this situation at all. And we had this very difficult problem, moral problem for us, because we wanted to organize the symphonic concert for people living with dementia and their carers. It was the end of this Cognizance project, and we weren't sure what should we do. Like we were thinking, okay, is it okay to have this great party when there's war? And what should we do? But in the end, we decided to have this concert. We had so many people who came there. We had also people from Ukraine. So it was a great possibility for us to be together, to maybe feel also less helpless. But we could feel that we are just participating in something important and very moving. Like, I still remember the day, and it was extremely intense. This is the picture of this final event. And now I'd like to say that thanks to international cooperation, that is the flow of communication between scientists, we are able to build many bridges. We had over the past 8 years, we had 6 international projects that have helped us to change the reality of people living with dementia and their carers in Poland. And we managed to build the first center, the meeting center in Poland, in Wrocław. I think we increased the accessibility of their care. We could see the increasing awareness of the caregiver burden. We are conducting regular training sessions for social and healthcare providers. We are increasing awareness among medical students. We conducted this first Polish social campaign on dementia. And now we are also launching a public debate, and we are trying to stimulate the government to think more about people with dementia. And this year we are starting 2 new projects with cooperation with the government. And also we are promoting and exploring this concept of social help. And I would like just to say that we hope to expand this project and these activities, and we hope that we will be able to include more Polish residents, because many people living with dementia who came from Ukraine say that they claim that they want to stay in our country. So we are just hoping that we could get access to them and we can just be in those projects together. Because I think this is the only cure we have for the consequences of dementia. That the only thing we can now know is to spread this knowledge about dementia and about the curse of this disease. And we can just establish more support centers, and we can create more support groups. And still, at least here in Poland, I know that still the social recognition about people living with dementia is still pretty low. So this is something we would like to change. Thank you very much.
Thank you, Adriana, for a great informative lecture, for your help, and also for keeping on time. So we have some minutes left, and as we discussed already the situation in Ukraine from your perspective, I think that your question can be directed also to Irina, who is here and who we had no time to discuss her contribution. So if you have any questions or comments to both presentations, the floor is opened. We can also discuss it later. I would before you think about your question, I would say that thank you once more for your practical help and for leading this, for the leading role in Poland in this issue. And I think that Breslau has also a historical role because Alois Alzheimer was full professor there. So Jona Rymaszewska is his successor in a way. So I think it's also important to mention. Yeah. So if there are not any questions now, so I think we can go on. Thank you very much, and we can go back to any presentation during this morning. Thank you. And our last speaker is Cassie Redlich, who will speak about opportunities for improving dementia care and support through the Pan-European Mental Health Coalition. Welcome, Cassie, and the floor is yours.
Thank you so much, and good morning, everyone. Thank you so much for having me here. It's been such a pleasure to listen to these presentations this morning, and I mean, I can't help but sit there thinking about, you know, how we best utilize something like this coalition that we've recently initiated at WHO to make sure that these kinds of stories are disseminated, that really we have an opportunity to have a whole lot of different people around the table for us as an organisation, and making sure that we work closely with organisations like Alzheimer Europe to make sure that we're disseminating all this amazing knowledge and experience. So that's what I was going to talk to you about today, a new initiative that we call the WHO Pan-European Mental Health Coalition, and how we might think about it as a mechanism for supporting improved dementia care and support across the region. But I wanted to put it into a bit of context because it doesn't stand alone as an isolated initiative. It's really nested within a series of documents that outline our vision and our priorities for health and mental health within the region, particularly under this document called the European Programme of Work. And this is a document which guides all our work within the WHO Regional Office for Europe. It's developed with our member states, and it really sets out the priorities and vision that they have and that they want us to support them with. This document runs 2020 to 2025, so we're getting almost halfway through the current programme of work. And nested within that is our European Framework for Action on Mental Health. So we developed this in response to the programme of work, making sure that this aligns very closely with the vision and the priorities that are set out in our programme of work. And so we have three key pillars within the European Framework for Action on Mental Health, and they are very closely aligned with the same three key pillars that sit within our programme of work. So the first one is mental health service transformation. So that includes building capacity and support for self-care and management. This is across all areas of mental health and wellbeing. Embedding mental health in community and general healthcare settings, and long-term care and support. The second pillar is particularly around emergency, so integration of mental health into emergency preparedness and response. So it really means we want to try and make sure that MHPSS, or mental health and psychosocial support activities, are firmly bedded within the public health emergency responses within our member states. And then the third is mental health promotion and prevention across the life course. So this is where we have a focus on mental health and wellbeing of children and young people, but also mental health and wellbeing of older people, including dementia care and support, as well as suicide prevention and workplace mental health. And I wanted to just highlight that actually we have some very clear priority actions within that third pillar on mental health across the life course, which specifically around focusing on dementia care and support. So these are priority actions for us as WHO and the Secretariat, but also for our member states, to support implementation of the Global Dementia Action Plan, to support development of national dementia plans for expanding early diagnosis, treatment and care for older adults with dementia, and to integrate mental health into all programs and activities supporting healthy ageing. So I wanted to set that context because the way that we think about the Pan-European Mental Health Coalition is really as an implementation mechanism. It's not a new thing. It's something that we hope is a strategy that we can use to really drive more effective, faster implementation of the priorities that our member states have already endorsed. So its purpose is really to act as this support mechanism for implementation of our European Framework for Action on Mental Health. But it also provides some other things. So it provides a structure for exchange between a diverse range of members with a shared interest in driving change in particular areas of mental health. It serves as a platform for peer learning and networking, and also it allows and has the opportunity to allow for coordination of advocacy efforts amongst coalition members. It's quite a large coalition and growing. So we have 6 working packages, and again, these working packages are aligned to the priority areas of the European Framework for Action on Mental Health. But important to say, and we're very much aware of this as time has gone on with the coalition, that they're not mutually exclusive, that actually we need to be working within these working packages, but also making sure that we're working across them, because things like, for example, mental health leadership or mental health service transformation, they can't sit in isolation from the work that's being done on improving care and support for older adults with dementia or mental health of children and adolescents. So we're trying to find ways to make sure that while we've got these working packages and we're establishing them and trying to build sort of momentum within these groups, that we're also thinking about ways that we can bring members together across the working packages. We had a high-level launch of the coalition last year in September. This is our regional director, Hans Kluge, and the Queen of Belgium, Queen Mathilde. And this was in Athens in September 2021. And our first actual meeting of the coalition membership was earlier this year in May, where we had a hybrid meeting of the members hosted from Copenhagen, our regional office. And it was a huge amount of work to get to that point. So it was really a good 6 to 12 months, really, of work, putting out a call for nominations, thinking about who might want to join this coalition, making sure that we had our key partners around the table, but also thinking that we needed to expand that group of people. We need different people around the table. We are very traditionally a member state organisation. We work for our member states. And we are used to having them as our primary stakeholders and our primary audience, but we're not so used to bringing other people around the table. So we expanded our call for nominations to include, well, certainly our academic partners, the academic partners that constitute our collaborating centre network, but also beyond that. So any institution could join, to NGOs, to non-government organisations, to civil society, to individuals. So we really put out a wide call. For this first meeting, we had 120 participants, but the membership is actually up to around 300 at the moment. And the first meeting we held parallel sessions for 5 of the working packages. And the objectives were really to start the ball rolling. We wanted to inform and align our membership and our supporters of the coalition with the coalition goals, and to give them some context as well, that this was something that really was nested in a series of documents which had support from member states, but where we really wanted to get momentum going for implementation, to begin conceptualising the development of these working packages. What could we do together as a membership? What did people want to put in, and what did they want to take out of it? And to facilitate just some early networking, really, amongst the members. So we had lots of different people. We were pretty pleased. We had we had representation from all our 53 member states across the region. We also had 18 of our WHO collaborating centres there. But then we had, as I said, NGOs, both at the national, the regional, the local level, public sector representatives, other universities. We had 2 individuals with lived experience. That was not good enough for us. That needs to change in the future. And so we've been actively looking at ways that we can make sure that we have people with lived experience very core to each of the working packages that we're running. And we had other UN agencies and also some private entities who can join as observers. To give you a sense of what we did with each of these working packages, so we held a working package that was specifically on mental health of older adults, and we walked them through a discussion framework, really trying to get them to hear from each other about what is going on for them in different contexts. What are some of the common challenges that they're facing? What do they want to get out of the work that they're doing in their particular settings? So we asked them about the challenges and barriers that they face in their work, in their settings, in their countries. We asked them about what their goals are, what their vision is, where they want to get to, and we asked them to start thinking about what are the actions that we can as a collective take. What are some very concrete steps that we can take as a group of people, and what can WHO do to support that work? And these are some of the things that the working package came up with. It's certainly not exhaustive. There are a lot of things discussed over the 2 days that we met. But some of them you'll see. Ageism and stigma was a very common challenge faced in a lot of settings. Lack of investment came up across all our working packages, and particularly here in lack of investment in age and dementia-friendly environments. And this issue of moving policy to practice and the implementation gap, again, came up across all our working packages, that really we can write documents that support policy making, we can have policies endorsed at a national level, we can even have policies written, but we still find it hard to see change happen on the ground. And so that's what our members told us that they really needed. Some of the goals, particularly important here, that our members wanted acceleration of the development of national dementia plans where they don't exist. They want acceleration of implementation of the Global Dementia Action Plan. They want to use and leverage the momentum around the decade of healthy ageing, and to establish a life course approach to healthy ageing. And some of the actions that they came up with, in fact, there were a lot of actions that they came up with in terms of ideas for actions going forward, but some very concrete ones here. So thinking about development of workforce competency framework and what that might look like in different care and support settings. And similarly, development of a quality of care framework and what that might look like for different parts of the service system. They really wanted, and this again across all our working package, that people wanted to know what were good examples of reforms, of implementation, where something has worked really well, where something has not worked very well, what are the lessons that people have learned across different settings, and particularly examples of implementation that's been sustained and scaled over time at a national level. So we've started the process of moving towards some of these actions, slowly. And what we've done, in fact, across all the working packages is to initiate a mapping exercise, really trying to identify what exists already so that we're not inventing the wheel when we come to some of this work, to identify existing guidance, tools, resources to support actions. So relevant policies and frameworks on treatment of mental health and neurological conditions for older adults, relevant quality frameworks and standards that exist, models of treatment and care which have been implemented and scaled, and case studies of good practice, of innovative practice, of practice where things have not gone so well. So really examples that our member states but also our members of the coalition can learn from. And where to from here? Well, we have a second coalition meeting coming up in Ankara in Turkey. That's going to be an opportunity for the members of these working packages to come together, both in their groups, but also making sure that they come together as a whole group to start talking about the sort of the synergies across some of these work packages. We really want to expand and strengthen membership, particularly of this working package on mental health of older adults. So I encourage anyone who's interested in joining to please contact, because I think this is something that we're very aware of, that some of our working packages are smaller than others. We want to make sure that they all have the right people in the room. If you've got ideas and you want your ideas to be in that room, then this is something that we absolutely want everyone to be involved with. And we want to, as I said, expand and strengthen that cross-package work to make sure that when we're thinking about leadership in mental health, we make sure we're thinking about what does leadership for improved dementia care and support look like. And we're also going to start looking at opportunities for sub-regional meetings and policy dialogues. So we do that with our member states. We want to think about how we can do that with our coalition members as well, noting that the region is vast, it's very diverse, and sometimes it's actually more helpful to have members who have similar experience and contexts coming together to talk about things that might work for them in their particular parts of the region. So as I said, please get involved. You can contact me. We have a coalition email that you can also contact. Membership is still open. You can nominate yourself at any time. It's a very easy process. So thank you so much for your time, and I look forward to the rest of the meeting.
Thank you very much, Cassie, for your informative lecture. We have still 1 or 2 minutes to present your comment or ask your question, please.
Thank you very much for all your work and for your talk as well. I think it's really good to hear how much work there is going on in mental health in later life. But for a dementia conference and here today, I just wondered if you could say a little bit about, given that often you met older adults with dementia, I wondered where younger people with dementia fitted into your framework.
Microphone is coming.
That's a very good question, and we have aligned our working packages with how we split up our work, and that is problematic at times. It's problematic for a lot of the working packages, and potentially here as well. So it hasn't actually been raised in any of these meetings, but we have discussed whether we need to change the language of the working package, and maybe that's something that you know, an easy fix is to just think about a different name for the working package on mental health of older adults. But there's no exclusions to the work that can happen under those working packages. So one part of it is about language, and the other part is taking the interests of the members of that working package and making sure that we can actually action what they want. And so there's no problem about working on areas that affect younger people with dementia as well.
Thank you very much. And there is another question from Jean. There are more questions, but may I ask you, please, for your quick questions and quick answers, because we have really last minute.
So I'll try to be very fast. So my name is Jean-Georges, the director of Alzheimer Europe, and I've had the privilege of attending a number of the meetings that you've mentioned. And just one of the questions I have is, how does WHO Europe and WHO Geneva, the headquarters, how do you collaborate? Because there's fantastic work being done by WHO Geneva with everything to do with the Global Dementia Observatory, and I'm just wondering sometimes how the connections are between WHO Europe and WHO Geneva on this important topic.
I may ask your brief answer, please.
My brief answer is we work very closely. I think in our regional office, we have always acknowledged that we have much less resource and expertise than our colleagues at headquarters. My lovely colleague Catalina here will be talking later today, and I spend a lot of time speaking with her. And I guess what we see our role is in that we have these amazing global products that have been developed over a long period of time by our colleagues with a lot of expertise in the area, and our job is to do the implementation within Europe. So in response, we work very, very closely on a very regular basis.
Thank you very much. Very explanation. And there I saw another brief question.
Thank you. Thomas Rutka from Nutritia, based in the Netherlands. This is maybe a question to all the speakers. So we've heard a lot today about the implementation of Western norms, of the Eastern countries learning a lot and doing their journey. Have you noticed anything that the Western countries could learn from the Eastern countries on your journeys and actually improve?
Of course, we spoke not only about East and West, but also about Central Europe, where in fact we are also Central and Eastern European country and Eastern Europe, and I'm sure maybe speakers want to answer, but yeah, there are many things. Maybe it is for next presentations, maybe, but maybe also organizations of services being more modest and so on. If I may, before we finish, add one message from our online members. Here is a message from Lucie, Czech Republic. Dear Irina, thank you for your effort. How many bridges you have built in such a time. Greetings and congratulations. And maybe it is a part of the answer that really building bridges is also important. So I would like, our time is over. I would like to thank you very much. Thank our speakers, thank you. Thank our technical support, and also Alexander Kurz for his emergency help. Thank everybody.